It is a huge honor today to be interviewing my buddy. I feel like you're my sister, Linda. You've been on Dentaltown since 2006 and have 7,000 posts. I mean,
Yeah.
I don't think anybody can read 7,000 Dentaltown posts and messages from someone and not feel like you're absolutely my twin sister raised apart since birth. I mean,
Oh,
seriously. And you've added so much to Dentaltown and Hygienetown. You have 2 online CE courses. You did an amazing course on xerostomia, an overview of current evolving therapies. You did another one, fascinating facts about saliva, 7 strategies for xerostomia management and the future of saliva testing. You recorded that live at the townie meeting where I got to meet your adorable daughter. Is she going to follow mom into hygiene? What is she going to do?
she's a singer.
She's a singer.
Yeah.
Huh. I got to tell you my one singing story. Singing is actually, it's not preference. And when people sit there and say, well, you just think that person's a good singer, you think it's not, because when I used to sing to my newborn baby, I have 4 boys, when they were like 1 year old and I was just rocking them and singing, they would reach up and put their hand over my mouth and say, no, no, daddy, no. So I'm sitting there thinking, how does this kid know I suck? He's only 1. He doesn't even know music, but they knew I was horrible at it. But so you're an amazing you're from London, England.
Yeah.
You started in an operating room, and then you decided that you wanted your patients to be conscious, so you switched to the dental field. Since graduation from hygiene school, she worked 8 years in periodontology, public health, general practice. Then you moved to Canada in 1990, and where you worked in a general practice, the regulatory body, College of Dental Hygienists of Ontario, as quality assurance assessor for 4 years. You've been writing articles, teaching continuing education. You completed your bachelor's degree in oral health promotion from O'Hare University, which is the Trish O'Hare, another good buddy of mine. So what made you
That's
move
right.
from London to Ontario? Probably the weather didn't change much from London to Ontario. That's about the same weather,
No,
isn't it?
it's about the same, but we thought there'd be more opportunity here for the whole family.
For you and hygiene specifically, or for your
Um,
husband and daughter? Or
More for my husband and daughter.
really more opportunity in Ontario, Canada than London, England? I think of London like the New York, say the Hong Kong of Europe, but you just thought there was more opportunity here, huh?
Yeah, yeah,
And
yeah.
what
I have a brother here who's done really well, so we thought we'd give it a try.
Yeah, and the dental scene in England has probably changed the most of any country I've been aware of since I got out. I mean, when I got to school in '87, it was like 99% of them worked for the government NIH dental system. And now, what would you say about almost a third to 40% have dropped out of that system and going private fee for service?
Yeah, a lot of them have opted out. Actually, I kept in touch with a dentist I used to assist back in 81, and he came to us for a visit a few years ago, and he said he had to opt out or else he would have gone broke
Yeah,
because,
they just think to save money, they just keep lowering the fees. I thought the most
yeah,
ridiculous hearing I saw was in California. They were having this government hearing on why the dentists weren't participating, and they're like, okay, my office has 65% overhead, and your fee is a 70% reduction. So I mean, do the math. I mean, you
exactly.
can't suck blood out of a turnip. I mean, at some point, this stuff has to be paid for. I mean, your rent, mortgage, equipment's not free. Your hygienists aren't volunteers. Your assistants aren't candy stripers doing this, in the evenings and weekend. It's everyone's job, and the government has a hard time realizing that you have to pay for it or you can't really get it. I mean,
Yeah,
you can only squeeze
exactly.
margins so hard. So what did you want to talk about? You could talk about anything. Did you want to? You've done 2 CE courses on xerostomia. Can we start with that? Um,
Yes, certainly.
yeah. Let's start at the very beginning. I want to ask you one off the wall question. That's because you're a mother and you're a hygienist, and I'm a father of 4, and I got a granddaughter that's 3. Did your daughter make you a granddaughter yet?
No, not yet.
Okay, so I've that's going to be the greatest gift that might come to you someday. But this whole disease this our whole profession doesn't start until someone kisses a baby. I mean, they're not born with Streptococcus mutans. They'll never get a cavity. They'll never have to brush and floss. They're never going to get gum disease because they don't have P. gingivalis. They're never going to get the oral pharyngeal cancer because they don't have the human papillovirus. Do you see, and you're very visionary, after doing this for several decades, do you ever see a future where babies will be born and not be contracting these diseases? Just like below the belt, they're not born with syphilis, gonorrhea, AIDS, et cetera. Or do you think stopping humans from kissing babies is just too great of a task?
I think that there'll be development of more vaccines to prevent periodontal disease and caries. Although we've been working on vaccines for caries for the past 40 years.
Do you hear of anyone thinking that that's a strategy within 5 to 10 years?
I haven't. No.
Yeah. But look how far they've come with AIDS, HIV. I mean, now when you get HIV, if you live in a country with access to healthcare, it's almost like a manageable chronic condition.
Exactly. Yes.
Yeah. So xerostomia. What are your thoughts on xerostomia? How prevalent is it? What's causing it? What do you do when your patients have it?
It's becoming increasingly prevalent, and I wanted to study it more because I had patients for several years who were always in great oral health, and then they started taking meds for blood pressure, etc., as they grew older, and then they started to get cavities. So I wanted to help them, and they were flummoxed because their oral care was always excellent, and they were regular attenders. So management of xerostomia is multifaceted to address the different problems, but there are a few products that will address more than one problem that are very useful, particularly substances with calcium and phosphate, like Novamin or Recaldent.
And what is Recaldent, and what was the other one?
Novamin.
Novamin?
That's the one, yeah.
And are these, and what kind of products are these? Gums, mouthwashes?
Yes,
toothpaste?
you can get toothpaste with Novamin now. That's Sensodyne Repair and Protect. And MI paste contains Recaldent. And certain gums, I think Trident Extra Care contains Recaldent.
And Recaldent is a calcium phosphorus supplement?
Yes.
And some people think that if you have a diet rich in calcium and phosphorus, that will actually show up in your saliva and have a remineralization. Have you read that?
I read a little about it, but I think it's quite limited unless you're producing enough saliva. The stimulated saliva has most of the minerals.
I think the biggest tragedy in what I see in my zip code is about 5% of Americans will end up in a nursing home someday. So all this care about nursing homes, if you're married, half the spouses will die when the other spouse is alive. So half will probably die whether they still got a spouse, but only about 5% into nursing homes. But when they go into nursing home, everybody that I know that's studying geriatric dentistry or whatever is saying that they get a root surface cavity about 1 per month is the average. So if you're in the nursing home for 18 months, you get 18 new root surface cavities. How? And then you go into those nursing homes and they got some poor little girl, and I don't know why seems like all the girls in the nursing home are like 5'2" and 100 pounds, and they they got to lift this huge man or this obese woman and get her in and out of the shower and feed her and all. She's got all these duties. Getting around to properly brushing and flossing her teeth is just it's just not going to happen. I mean, would you agree with that?
Yeah, yeah. The carers have so much on their plates that the oral care is not really a priority, unfortunately.
Yeah, and I mean they usually have to call the fire department 1 or 2 nights a week just because big old grandpa fell down in the shower and this little girl and her other friend from the other wing can't even lift him back into the bed and then the dentists are saying, well, hey, grandpa, no one's flossing his teeth. It's like that's just the lowest part. So what would you say to the hygienists and dentists listening to you when they have a patient tell you that their mom has Alzheimer's and dementia and she's now in a nursing home? What do you think they could do to help her avoid all this root surface decay?
I think they could start with xylitol supplementation that will reduce the carcinogenic bacteria and stimulate salivary flow. And they need someone to visit at least a couple of times a week to brush their teeth really well for them, and also apply fluoride and also supplements with the calcium and phosphate.
So would you switch their toothpaste to recalcitrant or Novamin or MI paste?
Yes, yeah.
What would be
Every night.
What would be your brand name recommendation for grandma in the nursing home? Would it be MI paste by Calcident?
Yes, yeah. That's made by GC America, and that I've achieved very good results with that. It gives relief from the dry mouth and also helps to reduce the acidity and improve remineralization.
So that's GC America, and that's Japan. GCC, General Chemical Corp of I believe it's Tokyo, Japan. Is it Tokyo?
I think so. Yes.
And then in America, they're headquartered in Chicago, GC America. So they have what's the brand name? MI Paste, or the brand's Recalcitrant, and then you call it MI Paste?
Yeah, the product is MI Paste.
And what's MI stand for?
Minimally invasive, like minimally invasive dentistry.
Minimally invasive dentistry, and you buy tubes of that like toothpaste.
I call it a night cream for the teeth because you apply it last thing at night after brushing.
Night cream for the teeth. That's a night cream for the teeth. Now that's a girl thing. I don't think any guys do any guys put night cream on their face?
Not to my knowledge.
Night cream for the teeth. So you recommend brushing with that before they go to bed?
No, you need to brush with a regular paste, and that's a treatment that you apply and leave on.
So it's not a toothpaste. It's a calcium phosphorus remineralization.
Yes.
That buffers the acidity back up to more neutral, where it's not carcinogenic friendly. And then what's another brand? You said Novamin. Who makes that?
Do you know? I can't remember. It's in a lot of different products. As I said, now Sensodyne is including it in one of their products.
Now Sensodyne, that just got sold, 10 years ago? Who bought Sensodyne?
I think it's GlaxoSmithKline.
That's right, GlaxoSmithKline. Yeah. They bought it for $1 billion about a decade ago. So they have their Sensodyne for sensitivity also has the calcium phosphorus remineralization.
Yeah, the repair and protect.
The repair and protect. Now, is repair and protect also the desensitization, or is that a totally separate toothpaste?
Yeah, it's also for desensitizing.
And the desensitizing was strontium chloride?
Now it's something else, and I can't bring the name to mind right now.
But they have
potassium nitrate.
Potassium nitrate. So they have the potassium nitrate and the calcium and the phosphorus all in one toothpaste?
Yeah, they have so many different formulations now because they actually it can get quite confusing for the consumer. When we first graduated, there was just one Sensodyne paste, but now I think there are probably about at least half a dozen.
Well, it's a big market, and
Yeah.
and what's funny is in the 20 richest countries, the fastest growing market is women over 100. The second fastest growing market is women over 90.
Oh
The
my.
third fastest growing market is women over 80. And I'm just sitting here thinking, wish I was a woman. Yeah, they say the male testosterone is very very damaging on smooth. You know, testosterone affects muscle, so you got your skeletal muscle, but then you got your smooth muscle, which is your arteries and veins, and then you got your cardiac muscle, which is your heart, and you just have to look at bodybuilders to see how that just when they start taking high doses of that, it just wrecks them. You know, very quick. So all men are just kind of wrecked by testosterone. Um, so if so, be specific. You're talking to a lady in your chair, and she says, "Linda, my mother's now in a nursing home. What would you tell her? What would you tell her to go manual versus electric? What toothpaste? What night cream? What would you tell? What should hygienists and dentists be telling the baby boomers when they say they just put their one of their parents in a nursing home,
Um,
knowing that on average you're going to get one root surface cavity a month?
yeah, I think they need to look at doable, make it as easy as possible to to care for the mouth, and I think xylitol will play a significant part in that.
And what brand? And would you talk about a sucker, a chewing gum, a candy?
I think as long as they get 3 to 5 exposures a day for 5 minutes, it doesn't really matter. I think the granulated xylitol is very valuable because they can put it in their tea or coffee or even in the water.
So you're from London, so you're probably a tea drinker, right?
Yes.
So tea is coffee making an impact in London, or is it still a tea drinking nation?
They like their coffee too. There's lots of Starbucks over there now.
Is there now? Was
Yeah.
you're originally, you said originally your ancestry is from Barbados. Was that a British colony too?
Yes.
So is that an English speaking country?
Yeah.
Are they tea drinkers too?
Um, they're more rum drinkers.
Rum drinkers? So you can buy xylitol granules and like put a teaspoon in your coffee or tea or water 3 to 5 times a day.
Yeah.
And you think there's good research that if they were doing that in the nursing home, it would reduce their root surface decay?
Yes.
And
Yeah.
what do you say about the electric versus for back to the senior citizen? Would you recommend a manual brush, or would you recommend electric toothbrush? Because a lot of them have rheumatism. What would you think?
I think an electric brush would make it much easier. Definitely.
Do you have any favorites on your electric toothbrush?
Um, I I like the Sonicare.
I like it because my dad, his business was Sonic Drive-In, and
Um,
it reminds me of a foot long chili cheese dog, onion rings, and a cherry limeade. But that's a whole nother story. But you like the Sonicare because obviously grandma or grandpa in a nursing home isn't going to be able to brush like they could if they were 21 years old.
no.
So when people say, well, what is a better toothbrush, electric or brushing? I'd first start, well, I'm sure if you're an Olympic gymnast and you're 16 years old, you could use anything. But
Exactly.
I think as your mind and body and dexterity breaks down, it probably helps a lot to have such technology. Some of these electric toothbrushes are connected to apps, and one of my guests was saying that she thought the apps, the electric toothbrush apps, is going to take off just because the kids would be able to monitor if it was being used. So just the fact that I could go in there and say, "Come on, Linda, this electric toothbrush hasn't been turned on for a week. So then, how did you brush Grandma's teeth for a week?" So, and I would assume in game theory, if a certified nurse assistant had 20 people on her wing and she knew 3 grandmas were being measured by an electric toothbrush connected to an app, that'd probably be the first 3 that got brushed. Would you agree with that?
I think that's quite likely. That's a super idea.
Yeah. And I love in economics. I forgot the name of the guy who got the Nobel Prize in game theory and economics, but yeah, I just think game theory is huge, and that's what I'm telling all my friends. I said, that I've gone in a dozen times. I've gone in and spent the second shift in a nursing home just to see what's just hanging out. And all you gotta do is bring them a dozen donuts and be friendly and hang out and just say I'm just looking at this from a public health point of view, and it's just I'm in fact, it almost makes me glad I'm a man, because there are almost no men in a nursing home. There's 100 women and just one man named Lucky, and so I probably, so this is probably more of a concern to you. So then she brushes with her electric toothbrush. What toothpaste would you recommend?
I think most of the leading brands are very good. That little bit of fluoride in the regular toothpaste is beneficial.
So just any of your Crest or Colgate.
Yeah, I think so. My current favorite is Repair and Protect, because I just like that formulation.
That's a GC America MI paste. No, that's the
No,
Sensodyne.
that's
That's Sensodyne
Sensodyne.
by
Yeah.
GlaxoSmithKline. So that's your go-to toothpaste, Repair and Protect.
Yes, and also actually Colgate has some very good ones. They have enamel repair formulas now with I think it's calcium and arginine type of protein.
So you've been a hygienist. What year did you graduate from hygiene school?
Where?
No, what year?
When? 1982.
So 82 to 2015, you've been a hygienist. Where do you think hygienist has gone from the day you walked out of school till now, and where do you think it's headed over the next couple generations?
I think we've changed from being a very task orientated profession that is like a tooth cleaning machine to and also being very focused on perio. I think we've come a long way in that we've expanded our horizons to include the systemic link with oral health. For example, in the seniors' homes, another good example is that if the mouth is overloaded with bacteria, they are more at risk for respiratory infections. And there's also a correlation between the number of cavities and cognitive decline. Although it's not established cause and effect, but it's quite compelling.
I agree completely. So what do you think these young hygienists over the next 10, 20, 30, 40 years, what oral diseases do you think they'll be looking for in the mouth, the oral systemic health connection?
I think they'll be more aware of the connection and will be a lot more effective at oral cancer screening in particular, and things like signs of malnutrition, signs of eating disorders. You can even see signs of diabetes orally, or things that would suggest it.
And Linda, you have 7,000 posts on is that Dentaltown and Hygienetown combined, or
Yeah.
if you post on Dentaltown, does it change your post on Hygienetown or vice versa?
Yes.
So when you're a member of Hygienetown, does that automatically make you a member of Dentaltown, or do you have to be a member of both separately?
To tell you the truth, I don't remember now. I did it so long ago.
Yeah, I think it's separate, but what's the difference for a hygienist? What is the difference between Hygienetown and Dentaltown for your user experience? Do you go to I see you posting on both. What What's the difference between the two?
Um, I like Dentaltown because I get some insight into the management side of dentistry, and I like to gain a bit of empathy for what the dentist is thinking about their staff and about the things that they worry about when they're running their business. Um, Hygiene Town, it's changed a lot over the years. Actually, there are a lot of great members who have really raised the bar. So it's a bit more. It's become a bit more scientific, I think, and a lot more interesting.
I always love the fact that so many research articles that I didn't see or I didn't read. I mean, there's so many journals, and it's not just so many journals. There's so many countries. I mean, you just and people are just posting these great articles, whether it be business or research or whatever. And I mean, and they're coming from literally 100 different countries, and
Yes,
I just love to see and then I also love to see what blows my mind is someone will post a study and I'll read it and then I'll look at the comments and it's like I'm half the time I'm like, oh wow, I didn't even think of that. Or I didn't even look at it like that. I mean
yeah,
it's amazing how every human being sees something differently. And I equate it to the Supreme Court. You notice, you got a constitution in the United States that's, goes back to 1776 or so. It's a several hundred-year-old constitution. All the words are explained. And then they put a law there, and almost all the decisions are like 5-4. So I mean, so here you would think, okay, well, if they're lawyers, they went to school for 8 years. They, all the words are the same. All the words have meanings. So you think they'd always all agree, but they almost never agree. It's always like, and the same thing on a dental research. It's amazing how, it'll say a research, and you'll say, oh, I'm thinking this. And then the first comment, you're like, "Oh, I see your point. Now I'm thinking the other way," and
yes,
and your head
yeah.
just goes back and forth, and it's really takes your mind out for a run. Do you think dentists would benefit going to Hygiene Town to seeing how the hygienists think?
Definitely. I think it would be good for them to gain more insight into to what we're thinking.
Yeah. Um, and another exciting thing I'm noticing in Hygiene Town is, you go back to 1998, Hygiene Town was all women. And now some of the biggest rock stars in Hygiene Town are men. My office manager's a man. I have 4 assistants. 2 of them are guys. And ever since the um, America started this free trade thing and lost 50 million manufacturing jobs, men are just pouring in to healthcare because it's 17 cents of every dollar of the economy. And
Yeah,
I just was in the hospital just recently for the third time for a kidney stone over the line. And about every 10 years, I drop a stone. And I couldn't believe. I mean, it was almost half men in the emergency room section,
yeah.
and yeah, very very changing. So what else is so what do you think about all the talk about hygienists practicing independently? Europe and Canada, where they're want to have expanded duty assistants go on to Indian reservations. What do you think of all the expanded duty functions, independent practicing, all those hot political topic buttons?
They were originally mandated to improve access to care for. There are still sections of the community, a significant number of people who don't have dental insurance, and particularly the elderly and also newcomers to Canada and children. So I think we do need expanded access to care. Unfortunately, what I've noticed is some hygienists they're doing a great job actually in independent practice, visiting seniors' homes, etc. But there are still some who have set up shop in the city near to other dental offices where you can't really say there's a problem with access. Um, I think it is valuable. It has its place, and actually, I would like to see, say, a hygienist in a building with surrounded by other dentists' offices, and the dentists outsource their hygiene services to an independent hygiene office.
You would like to see that?
Yeah.
And why would you like to see that? Tell me your vision.
Um, I think it could work. I think it's one less thing for the doctor to worry about in their office. It's just the logistics of having someone who's going to go to one office to see the dentist and another to see the hygienist. But I think if they're in the same building, it could work very well.
I think it's I think you have to remind dentists all the time that they have to be patient centered and not doctor centered. They all believe in their heart. They all look in the mirror and believe they're doing everything patient centered. But then when you show them things like gravity, math, physics, like their office hours are Monday through Thursday 8 to 5. In the city of Phoenix, Arizona, you have a toothache evenings, Saturday, Sunday. I mean, you're almost completely helpless. And I think too many times when they talk about any of these hygiene issues or expanded care or et cetera, they're not realizing that this is a huge country and there's a lot of poor people who don't have access to care. And the way they talk, it seems to do a lot more with money and a lot less with poor people, And you've lived in have you spent much time in the United States? I mean, I've seen you in Vegas a couple of times. Have you traveled much in the United States?
Very little, actually.
Very little, because I've been to 50 countries, and I can't think of three bigger melting pots than England, Canada, and the United States. I mean those are about the only three countries where there's someone from every country everywhere you go.
Yeah.
I mean, you go to all the other countries. I mean, like you go to Vietnam, they're all Vietnamese. You go to Korea, they're all Korean. You go to Japan, they're all Japanese. You go to Poland, they're all Polish. So who do you think is the bigger melting pot? You think the United Kingdom, Canada, and the United States are about the same? Because I actually think Canada would actually be more melted than UK. I'd rank it Canada, UK, than the United States. I mean, it'd be a tight race, but is that how you see it?
Yeah, I think they're very close, definitely.
And go ahead.
That would be hard. It would be hard to say, actually.
So what's your favorite city to visit?
My favorite city? Well, actually, I still have a soft spot for London.
Oh, yeah. But with a caveat. It has to be during the good weather. You don't want to get caught up in the North Sea in February when there's 11-foot waves and a storm rolling in. I mean, that is one cold place in the winter. Would you agree?
In certain parts of England, but I actually like that little bit of that steady drizzle. I quite like that.
Really?
Yes.
I think you're the first person I've ever met on the planet that ever said that. What did you just like the beauty of it, or just wakens you up, or what do you like about it?
I think it started when I was in an overheated office building in Toronto, and there was a bit of drizzle outside, and I felt so good when I went out, and it reminded me of home.
What I liked about London, last time I went there, spoke to the Royal Canadian College of Dentists and took my son Greg, is just that, I mean, just every block there's a restaurant you've never tried, a food you haven't eaten, the bands are from every corner. It's just I always thought the rock and roll explosion in the 70s, where all the major bands were from London. I always think that it was because those musicians there were exposed from sounds from every corner of civilization, and they were just kind of wrapping them all up together and kind of having their unique sound. So, how did you? You've told me that you originally were shy, and you overcome shyness and started later on in your career started writing articles and public speaking. You've lectured for us at Townie Meeting, and your reviews were just amazing. Your CE course are amazing. What was it like growing up shy, and how did you overcome shyness? And talk about that part of your journey.
I definitely needed a little push. I had to have a push from somebody else to before I overcame it. And that was the invitation to speak at the Towney meeting, actually.
And who pushed you?
Trisha.
Trish O'Hare?
Yeah.
Oh, how adorable. I love Trisha. She I don't think she has any shyness of speaking. I mean, I wonder,
No.
did she ever in the beginning?
She never mentioned it to me, but actually, when I was preparing for the Towney meeting, I contacted all the speakers whom I admire in our profession, and most of them said that they were shy and nervous still about speaking.
Well,
And
you didn't
was
contact me,
surprised.
so I must not be one of the speakers you admire.
Yeah, I should have asked you too, actually. I don't know how that happened.
And what did the speakers tell you? And was everybody having the same shyness?
Not necessarily shyness, but definitely nervous before speaking. And they said that if you're not nervous before speaking, then there's something wrong. You're too complacent.
Well, I mean, they say that in sports. I mean, if you're not a little nervous before the big game or the big sporting event, that's not a good sign. They always say in boxing, if a boxer crawls into the ring and he doesn't already have a sweat going, he's probably going to get knocked out in the first round. He's not even ready. So I can see how the pre-jitters works up. Now, how many times have you lectured since? Or how many times have you lectured total?
Probably about a dozen times now.
Is it getting easier?
It is actually. I enjoy it a lot now. I find it's like talking to a group of friends. So it's a lot of fun.
So what secrets or advice would you give to someone who's listening to you right now on their commute to work that has often thought about maybe speaking at their, breaking the ice and speaking for their local study club or their local state meeting and become a speaker, but they got butterflies in their stomach? What kind of motherly advice would you give them?
Speak about what you know and prepare very well. And take a public speaking course or join Toastmasters.
Did you do that?
Yes.
Well, tell us what you learned. What's the low hanging fruit from Toastmasters? Is it just getting more opportunities to speak and getting over it, or did they actually give you sound tips of speaking?
Both actually. I learned a lot from them, and funnily enough, I also learned. I went to a Toastmasters that's near to University of Toronto, so there are a lot of young people, and I thought this is a nice place for singles to meet too. So I was a bit of a matchmaker too. But
so you were fixing people up at the Toastmasters Club? You were pairing off the singles?
Well, in my mind, I was. But yes, it's a great place both for the opportunities to speak regularly and get feedback from your fellow members, and they also teach you good techniques.
And what are some of those good techniques?
They have somebody called an R counter who counts the number of times you say and that just gives you an awareness of how you project your voice and how you speak and communicate.
I think what was that book Outlier where Malcolm Gladwell said, that all the experts basically all spent 10,000 hours before they got to the top, and the average person's 10,000 hours was about 10 years. And I've noticed that speaking, I've spoken a lot since I was 27, I think about 1,500 times. And what I've noticed is through the 3 times in my career that they, back in the day, you had these slide carousels. And so you had this big suitcase and you had, 6 racks of slides and all this crap. And your suit was in there and your fancy shoes and all this stuff. And you travel, comfortable in sweats and everything. And all 3 times they lost my luggage.
Oh,
And I'm sitting there in Nike tennis shoes and sweats and a sweatshirt, and you're thinking, oh, this is just the end of the world. And at the end of the seminar, those were the three best seminars I ever gave in my life. And I always look back at those tragedies that if I was talking to you about your daughter's 31, she's the love of your life. I met her in Las Vegas. She's absolutely has your beauty, your karma. I mean, she's just a doll. That if you and me were going to talk about her for an hour, you would need PowerPoint. You would need to put on a
no.
dress suit. You would need Sunday shoes. You would need to get a mani pedi, and we would just be sitting there. And I always looked at that if you just go there and talk about, like you say, something you're already passionate about, something you don't have to study about, something you don't have to memorize. You know, it's all from the heart, passion. If that's what you're talking about, get rid of all the slide. And it sucks because the way these dental meetings grade you, well, did they have proper handouts? Did the lecture follow the slide? I mean, it's like the whole critique of the seminar. It's like who's ever writing the critique, obviously not even a speaker. Because and that's why I do stand up, because stand up I think is the ultimate performance. You don't get to take PowerPoints and slides and toys and props. You're just up there at the microphone, and
Yeah.
you crush it or you bomb, and you learn in stand up that everything around you is a crutch, and the best speakers are the ones that are, just holding the mic and talking to you like you're a friend, and they can explain the concept and you can see it in your brain without some PowerPoint or some slide or some handout or some sample, or you know what I mean?
Yeah.
And
Yeah.
yeah, but that's why I also think I like to do stand up because it gets all the performance uh juice out of you, so that when you go to dental you can concentrate on dental. Instead of joke telling and cracking up the audience, because so many times you walk out there, you just want to make them laugh for 8 hours. You're like, okay, they're not at a comedy club, they're at a dental convention, so get your yahoos out at a comedy club and then go try to talk about dentistry. It's hard to keep my mind focused on dentistry. So um what's going to be your third Dentaltown CE course? I know you have another one in that amazing brain of yours. What topics are you passionate about now? You've done xerostomia. You've done fascinating facts about saliva, 7 strategies for xerostomia management. What if you did a third online CE course someday? What do you think it would be on?
Well, I'm speaking at the Townie meeting next year, and I'm going to speak about care of patients with eating disorders.
And
And
that's anorexia nervosa, bulimia.
yeah, yeah,
So 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 um so the dental diseases caused by them vomiting an acidic vomit over their teeth and dissolving their enamel.
that's right. And I think most of us are aware of those things, but there are a lot of early warning signs which I wasn't aware of previously until actually this is about 10 years ago. One of my patients said to me her daughter's recovering from an eating disorder, and could I be vigilant for signs of relapse? And I said, yeah, sure. And then I realized I didn't really know that much apart from the erosion. So I did a lot of reading about it and had a couple of articles published earlier this year, and so I decided that should be my topic for this convention. And also, um, it, we have a very important part to play in dentistry in secondary prevention of eating disorders. We are often in a better position to spot the early warning signs than a physician, and so we can refer them to get help.
And what are those early warning signs?
There are things like with bulimics, they might have an abrasion on their knuckle
On
of
their
the
hand knuckles?
yes, yeah, from inserting their fingers to induce vomiting, and they might have certain skin conditions that suggest malnutrition, or their demeanor might reveal that they might be a bit dazed because of electrolyte imbalance or dehydration. So there are lots of things we can look out for.
So, what is anorexia nervosa very different than bulimia, or?
There is a bit of overlap. Some people with bulimia were formerly anorexic, and some had a problem with binge eating and were obese, and then they became bulimic. And some anorexics also purge. But the main difference between an anorexic who purges and bulimic is a person with anorexia is severely underweight, whereas bulimics are usually more of a normal weight or slightly overweight.
And is it still, no offense saying this, but is it still mostly a woman disease? I mean, a female disease?
It is, but there are increasing number of males with the disease, and males also seem to tend to have problems with muscle dysmorphia, where they might think they're really puny when they're actually very well built. They perceive themselves as being very puny.
Is that, do those guys, are those the ones doing all the steroids in the gym because they see
Probably
body dysmorphia and they just keep injecting?
Yeah.
Because when I go to the gym, I look at some of those guys and it's like, you really look at them and you think that must be a mental disorder. I mean, why would you be giving yourself a shot of that in your glue? Because they talk about it openly at the gym I go to. And it's like, why would you take a shot of that in your, I mean, because you already look like you can't touch your hands behind your back. I mean, you already look like you've lost half your flexibility. I mean, you look like you're morbidly obese, but with muscle. And I asked all my friends that are women down there, I say, do you find that attractive? And all of them say, I think it's like it's gross and that there's something wrong with you to want to look like that. Or do you not agree?
I think definitely if they go to such lengths to achieve this extreme muscle mass, that there is a problem. If they're going to sacrifice their health to do it, because the whole point of working out is to be healthy.
Yeah. So So body dysmorphia, that is but they say, I always see that cartoon where a fat man is looking in the mirror and then the mirror shows an image of like a bodybuilder, and then a beautiful woman's looking in the mirror and is showing an image of a overweight lady.
Yeah.
So and that's probably not because a boy or a girl, probably because of the way our society objectifies women.
Yeah, definitely social factors are very significant in eating disorders.
Also, go ahead.
The average fashion model's about 6 feet tall and 117 pounds, which is like very few people can look like that. Actually, I've seen a few models around town near my office, and in person they're like a different species. They're very tall, but they're very small bone. They're just elongated. So it's just like a specific kind of genetic type. Really.
So what do you do for the erosion on the teeth? Are they usually sensitive? I mean, is the anorexia nervosa purging, or the bulimic, are they complaining to the hygienist that their teeth are sensitive from this, or do they openly admit it? I mean, if you just ask this patient, is she most likely to admit it or deny it?
Most of them don't admit it. They'll say they have a lot of food allergies or something like that, so they can justify their restricted diet. They're very concerned with the appearance a lot of the time, so they'll end up going to the dentist because they're concerned about their appearance.
And what about sensitivity? Are they complaining about sensitivity?
Yes, quite a few are complaining of sensitivity.
And what do you usually recommend for that? Back to that Sensodyne, or?
That can help, but the main thing is quite a dilemma for us actually, because a lot of them are quite secretive. So you can make them, if they're open about the condition, you can make them a guard that they can wear to protect the teeth during purging, so that the acids don't, to minimize that. But they need similar remineralization and desensitizing protocols.
And also it helps with the girls I've talked to is that right after you purge, the acid has softened your teeth, so that is exactly not the time to go take an abrasive toothpaste and start scrubbing your teeth. So go neutralize all that with water and swish with water and try to wait as long as you can. Maybe take some xylitol or mouthwash, but don't get in there with Colgate and Crest and electric toothbrush on that softening enamel.
Exactly. So they can rinse with water with baking soda to neutralize the acid.
So, and then I also want to say something to the young kids. They're coming out of school and they look at someone like me and Linda and they say, I'm going to go work for this guy or this gal because she's going to retire in a couple of years. But it's funny, I tell the young people that what everybody says they're going to retire, when they get up to the retirement age, they usually don't retire. What are your thoughts on retirement now that you're getting closer to these magical dates when people just say you're done, hang up the shingle and retire? Do you want to retire?
No, that actually now it's like those numbers are quite meaningless to me now, because I think I'm enjoying the profession more than ever, actually. And I feel I have, at this phase in my career, I think I have a lot to offer to patients and to my colleagues.
Yeah, and I also will turn to a 25-year-old and I say, what would you think of never earning a paycheck again? They're like, what? I could only survive 2 weeks. Well, it doesn't matter what you make; it's what most humans spend. And I never find a 60-year-old or a 65-year-old dentist who says, yeah, I don't need any more money. Even if they have a lot of money, even if they're debt-free, if you're debt-free and you have a lot of money, you just have bigger, grander goals. They'll want to, go here for a month, or they'll want to go, to the safari, or they want to help their kids or their grandkids, or I think that's the basis of the entire economy, is that 7 billion people wake up every morning with wants and needs. And since everybody wakes up with wants and needs, that's the economy. And until, I don't know what a magic age does to where a human wakes up and says, you know what, I don't have any more wants and needs. Yeah, I don't need any cash. And yeah, I just want to sit around and watch Oprah Winfrey all day on TV and watch Jerry Springer for 2 hours in the afternoon. I think they finally get really good at their profession. I mean, you've done it 10,000 hours. You've done that 2 or 3 times. So you get really good. Your money gets better. You still have wants and needs. And so whatever you think your retirement goal is it's not going to happen for a myriad of reasons.
Exactly.
I mean, I know dentists who got jobs with dentists that were 67 years old who was telling them they're going to retire in 2 years. And that guy's still working 20 years later.
I think that's great.
Yeah, I do. I think wanting to retire is a sign of burnout or depression too. I mean, if you say you want to get out of dentistry and then go start a whole nother career, that's exciting. But if you just say you want to get out of your profession and just not do anything, I think that's I think that could be a red flag.
Yeah. Nowadays, retirement means something different. Usually, nowadays, it means just a change of pace or a slight change in direction, but not ceasing to work.
So what are your hobbies then? What do you do to be well-rounded? Is your daughter still at home, or has she moved out and flown away?
No, she lived in Japan for a while, but now she's back.
She was singing in Japan?
Yes.
Did you go visit her in Japan?
No, I didn't. The year went so quickly, and then my mother was ill in Barbados, so I didn't get to Japan, unfortunately. But yes, I would love to go there.
So do you visit your mother a lot in the winters? You leave that cold Canada and go down and visit your mother in the Caribbean?
Yeah. Once or twice a year.
Yeah. Is that still home to you?
No, I've never lived there because I was born and raised in England. So
But
I
your
guess
mother and dad were both from Barbados?
yeah,
And
they lived in England for a long time and then they retired and went back to Barbados.
and because that's where they were born?
Yeah.
Yeah, I think that's a huge impact on people. My mother has two kids, now living in Phoenix, me and my sister Shelly. But she was born in that Wichita, Kansas, and I think you just, no matter how cold it gets, no matter how long the overcast, no matter how brutal the winters, that's just all she knows.
Yeah. Yeah.
Yeah, could you see yourself retiring in Barbados?
No.
And why not?
um I Well, I can't see myself retiring for a while yet. And I like Canada. I could see myself spending a couple of months in the winter in Barbados, but not to live there all the time.
And what's the difference? Do you ever pop your head in a dental office or talk to dentists or hygienists in Barbados? What's the difference really? What's different about oral health and delivery in Barbados versus Canada?
Um, well, less people have insurance, so I think it's a lot. It's nearly all fee for service. There's no insurance kind of middleman, and I think that the public health coverage is very limited.
So you would say on your observation, as much complaining as there is about insurance and Obamacare and Medicare and Delta and Blue Cross and all the whining and complaining about all the insurance, you do think that overall on a macro level, countries with more dental insurance have a more robust dental industry? Would that be fair to say?
Yes.
Or do you think it just comes down to economics, that it's a more poor country?
That's also a factor, but I think definitely people having insurance coverage definitely drives a lot of the industry.
Yeah, so Barbados, that's close. It's right by Trinidad, Grenada, south of St. Lucie. That's
Mm,
on the Caribbean cruises. They have the East, West, and the South Pack tour, and
yeah,
that's you hit that on the South Pack tour. Correct,
yeah.
correct.
Um, it's the most easterly island. It's furthest into the Atlantic.
It's the most
The other
easterly.
islands. Yeah.
Yeah, right above Venezuela.
Hmm.
So I'm excited now that Cuba's opened up. Do you have any interest to go into Cuba and see what their dental schools are like?
Yes, I would like to actually.
I am just itching. I mean, they find that society's finally opened back up with the United States. It's about time, long overdue. I would just love to go down there and see some Cuban dental schools. Do you think you might be doing that?
It hadn't occurred to me. I was thinking more of the beach.
You were thinking more of the beach. So how many? Do you know anything about are there any dental hygiene schools or any in Barbados?
No, there's they have the University of the West Indies, so I think most of the islands have a campus. The dental school I think is in Jamaica. They have a couple of dental schools there, but I don't think they have one in Barbados.
So no, and how many people live in Barbados?
About 300,000.
300,000. And the dentists are from Jamaica.
They're from all over, or a lot of Barbadian dentists who study in the US or Britain or Canada, and then they go back.
Did you notice this or not, or is this completely unprofessional to say that a lot of times when you're down in um, the Central South America or the Caribbean and you find an American born in America, went to dental school in America, born and raised in America and practicing down there, that usually they had their license taken away?
Oh no, I don't know about that.
I mean, I can name a dozen off the top of my head.
Oh, no,
Yeah.
I didn't know that.
And they just said, you know what, they're tired of the game, they're tired of all that, but anyway, but 10 for 10, thought it was the best thing that happened to them because they would never go back home.
Yeah. Oh, that's
So
scary.
you're going to be lecturing at the county meeting, and what is the date on that? April? You know the date off the top of your head?
March 30th to April 2nd.
I think that's sad that you know the date and I don't. It's say it again. It's March 30th,
To April 2nd.
and what day? And you're going to be lecturing at that time.
Yeah, yeah. I don't know which day yet.
Okay, well, Linda, seriously, I don't know what to say to you. I mean, 7,000 posts. I mean, it's just, I mean, I think I've read every single one of them since 2006, and 9 years, 7,000 posts. You share so much energy and karma and knowledge and love and respect, and I've seen you cheer people up and educate them, and I just think you're just a phenomenal person from your head to your toes. And thank you for all that you've done for dentistry, for Dentaltown, for Hygienetown, for Town and Meeting. Thank you for everything.
Oh, thank you thank you. Dentaltown and Hygienetown has really sparked my professional development and helped me to get my dental hygiene mojo back.
Well, you got it back in spades because you got it. You got it more than about anybody I've ever met. And tell your husband and your daughter I said hello.
I will.
Okay, bye-bye.
Okay, lovely to see you.
Lovely to see you.